Breastfeeding is a natural and beautiful way to nourish your baby, providing them with all the essential nutrients they need to grow and thrive. Exclusive breastfeeding, also known as full breastfeeding, is when a baby receives only breast milk and no other liquids or solids, not even water, for the first 6 months of life. This is recommended by the World Health Organization, the American Academy of Pediatrics, and many other health organizations as the best way to ensure optimal health and development for your baby. There are many benefits to exclusive breastfeeding for both the baby and the mother. For the baby, breast milk is the perfect food, containing all the necessary nutrients in the right proportions for optimal growth and development. It also contains antibodies that help protect the baby from infections and diseases, reducing the risk of illnesses such as ear infections, respiratory infections, and gastrointestinal infections. Breastfeeding has also been linked to a lower risk of sudden infant death syndrome, SIDS, and a reduced risk of developing chronic conditions such as obesity, diabetes, and asthma later in life. For the mother, breastfeeding can help with postpartum weight loss, as it burns extra calories and helps the uterus return to its pre-pregnancy size more quickly. It also reduces the risk of breast and ovarian cancer, osteoporosis, and cardiovascular disease. Breastfeeding can also help strengthen the bond between mother and baby, as it provides an opportunity for skin-to-skin contact and promotes feelings of closeness and security. However, exclusive breastfeeding is not always easy, and many mothers face challenges along the way. Some common issues include difficulty latching, low milk supply, engorgement, sore nipples, and mastitis. It is important to seek support from a lactation consultant, a breastfeeding support group, or a healthcare provider if you are experiencing any difficulties with breastfeeding. With the right support and guidance, many of these issues can be overcome, and breastfeeding can become a positive and rewarding experience for both mother and baby. It is also important to take care of yourself while breastfeeding. Make sure to eat a healthy and balanced diet, drink plenty of water, get enough rest, and take time for self-care. Remember that breastfeeding is a two-way street, and your own health and well-being are just as important as your baby's. When it comes to breastfeeding in public, it is important to remember that it is a natural and normal part of life. Many countries have laws that protect a mother's right to breastfeed in public, and most people are supportive of breastfeeding mothers. If you feel uncomfortable breastfeeding in public, you can use a nursing cover or find a private place to feed your baby. Remember that you are doing what is best for your baby, and you should never feel ashamed or embarrassed about feeding your child in public. As your baby grows and starts to eat solid foods, you may wonder when to introduce other foods and how to wean your baby from breastfeeding. The American Academy of Pediatrics recommends introducing solid foods around 6 months of age, while continuing to breastfeed for at least the first year of life. You can start with small amounts of pureed fruits and vegetables and gradually introduce other foods as your baby gets older. When it comes time to wean your baby from breastfeeding, do it gradually and gently, allowing both you and your baby time to adjust to the change. In conclusion, exclusive breastfeeding is a wonderful gift that you can give to your baby. It provides numerous benefits for both the baby and the mother, and can help set the stage for a lifetime of good health and well-being. While there may be challenges along the way, with the right support and guidance, breastfeeding can be a positive and rewarding experience for both mother and baby. Remember to take care of yourself, seek help when needed, and trust in your body's ability to nourish and nurture your baby. Breastfeeding is a beautiful and natural way to bond with your baby and provide them with the best start in life.